My name is Cassandra Romas, and welcome to 30 Medical Minutes. A chronic concern of many patients, whether they are elderly and in bed, have chronic illnesses like diabetes, or are recovering from surgery, is wound care. Taking care of wounds and sores is a most important aspect of recovery and well-being. If our wounds are treated and healed, patients can regain independence as they become able to participate in daily activities with comfort. Our guest today is Dr. Robert Roland, the Medical Director of the Wound Healing Center at Overlook Medical Center in Summit, New Jersey. This wonderful facility specializes in the treatment of all kinds of wounds and features all the latest equipment and techniques to accomplish this healing. We will hear a description of the Wound Healing Center and be informed how the treatment at the center has impacted patients' lives. This is a most worthwhile and important topic for all of us to hear. So please stay tuned and listen to Dr. Robert Roland explain to us about the wonderful work at the Wound Center. And now let's welcome Dr. Roland to 30 Medical Minutes. Thank you for joining me, Dr. Roland.
Thank you for asking me to be here.
That's great. So our topic is the Wound Care Center, which you are intimately involved with, but let's learn a little bit about yourself and your practice first.
Well, I joined Overlook Medical Center back in 2007, but was asked to become the full-time medical director after being one of the panel physicians. Since 2008, I was asked in 2012 to take over as full-time medical director for the facility, which I have and have remained there in that capacity.
And your medical background is in?
Infectious diseases. I've been infectious diseases since 1991 and had been involved as an acting medical director for a HIV center in Eastern Union County for the better part of 20 years, and had to give that all up when I began my time with medical director.
Taking care of wounds and sores, which is related, of course. So the Wound Care Center is at Overlook Medical Center, as I said. Can you give us a little bit about the history of the center? When did it start?
Well, the center itself started in late 90s, 1999, under the direction of Dr. Norm Luca, who still remains as a panel physician. He, being a vascular and thoracic surgeon, understood the need for a comprehensive wound management, so he began the center in one of the basement areas of the hospital. As the center began to grow, patient numbers, physicians that joined the panel, it was decided that they needed a bigger facility, so they moved it to the Medical Arts Complex number 2 on the campus of Overlook Medical Center, where it is today. We presently have 6 treatment rooms, 2 hyperbaric chambers, educational material and preventive services that we provide, including assistance with diabetes and vascular issues. Quite proud of the center itself. I mean, it's one of the fewer centers that is Joint Commission certified. We had our most recent recertification in February of this year. It was supposed to have taken place in the fall of last year, but due to the how busy the Joint Commission was, it was delayed until February. But we've had 4 certifications, and our hyperbaric unit has had 3. We completing our most recent certification for our hyperbaric unit in April. So it's been a busy time, and we continue to the day-to-day job of taking care of patients with wounds.
Well, it sounds like an incredible center, and to be specializing in wound care and to grow so tremendously shows you that obviously there's a great need for specialized attention to this. And it looks like there's specialized people, physicians and other medical personnel who need to be trained in this area. Is there a special certification for them?
Well, all of the physicians are board certified in their particular specialty. Myself, infectious diseases. We have dermatology, internal medicine, vascular surgery, podiatric surgery, and plastic surgery. We actually opened a second center because of the need in Eastern Union County in Union in 2013. Between the 2 centers, we see 500 to 600 patient visits a month at the Summit facility and 300 to 400 visits at the Union facility. All the docs, like I said, are certified in their specialty, and many of us, myself included, will be sitting for a certification specifically in wound care. Those of us that render treatment in the hyperbaric unit, we all again have had training, specific training as it relates to hyperbaric medicine. All the nurses that work in the unit, though, are all certified in wound care or wound and ostomy care. So yeah, there's a lot of training that has gone into the personnel at the facility.
Well, I think it's important for our audience to know that this wonderful facility exists with highly specialized, highly trained, and people with now a tremendous amount of expertise. And that is how hopefully you get great results. But I'd like to know something. Why would somebody need to go to the wound care center? At what point, when you have a cut or a sore or something, do they need to turn to you for help?
Well, all of us have had wounds at some point in time in our lives, and most of the time, besides the acute injury, it goes relatively unnoticed and it goes on to healing uneventfully.
Right.
There are other times, either in our lives and or with diseases that we acquire over our lifetime, where all of a sudden things that are minor and that go uneventfully to healing, all of a sudden they don't. And they become something that becomes chronic, where either the patient is just managing this wound themselves for weeks to months, or a patient just notices that this wound, which normally would have healed in a week, is still present at 2 weeks. Mm-hmm. They may seek attention from their primary care physician, who may attempt treatment themselves, but when it again does not go on to heal, either the patient and or the physician may then refer the patient to the wound center, where we can try to sort through the reasons why it's not healing and then try to help them to get it to go on to heal.
I don't want to go into it too deeply, but are some of the symptoms of a wound that doesn't heal pain, or is it red? Is it swollen? Is it pussy? What would you see?
Well, wounds present in a variety of ways. I mean, patients may notice them because of pain, but in the case of diabetics, a lot of times they don't notice pain because they have neuropathy associated with their disease. What they notice is their socks have blood on it, or somebody in their family notices they leave a trail of blood around when they walk. Other patients will just notice that they have this area on their leg and that it is excruciatingly painful, and the wound seems relatively minor, but the pain seems out of proportion to what the wound really looks like to them. Mm-hmm. So it triggers them to realize that something else is going on, and again, seeking out attention to help that.
You know, Dr. Roland, in preparation for our show, I visited the wound care center, and as I was sitting in the waiting room, there was a patient sitting to the right of me, accompanied by, I think, his daughter, and I noticed that his feet were bound in these big Velcro black booties, and he had big white socks over his feet. And as I was just kind of noticing this, the receptionist opened the door and the nurse came out and said, "Mr. So-and-so, the doctor will see you now." So he stood up and he walked over to the entryway, and with his daughter following him, and I overheard the nurse say, "Mr. So-and-so, you're walking now. How wonderful. How long have you been walking?" And then he answered, "Oh, 2 or 3 weeks," and then they proceeded forward and the door closed. And I thought to myself, that's what it's all about. The wound care center must have done something for his feet, cleaned his wounds, made his wounds be diminished, so that the man was up and walking. And where we take it for granted, he was so grateful and so happy. I mean, God bless you people for doing this. This was wonderful.
Well, I mean, that's a real good example. Chances are the gentleman you're talking about probably was diabetic and had a diabetic-related foot ulcer, which was being cared for usually by one of our podiatrists. It sounds like he had a cam walking boot on, which is, again, a common thing that we do in the wound center. But, you know, you kind of describe one type of patient. We have many. I mean, I have several college students that have had surgery for pineidal cysts, which are a relatively common entity.
Well, say that again. What was that?
A pineidal cyst,
okay,
which occurs usually at the bottom of the spine. It's something that kind of forms during our development when we're infants, and later on in life many times will develop and enlarge, become infected, and that's when we notice it. We end up getting it removed. The ones that heal uneventfully, we don't see. But the ones that don't heal uneventfully end up many times with chronic wounds. And this is usually many times a healthy 18, 19, 20-year-old who now has this wound that they can't heal. They have trouble sitting in their classes. They have trouble where they can't participate in physical activity. And they come to the wound center looking for help to try to get these wounds to close. That's another type. We have patients that have recurrent problems either with arterial or venous disease, or they form ulcerations on their lower extremities which will not heal. Patients that develop lymphedema for one reason or another, based sometimes on cancer, based sometimes on other pathology, but again, they form these openings in their legs that drain chronically. Patients cannot live the life that they were used to living, and they come to us looking for help for that. The patient with the acute surgical wound, they get through a major abdominal surgery from something very serious, and then the wound doesn't go on to heal, or it opens up spontaneously, and now they've got this open wound in their abdomen, and again, they're looking for somebody that's going to help them to try to get this wound to close. So these are all different types of patients. Patients that have a heart attack, but because of that heart attack, they're sedentary. They're then laying for long periods of time, and they form pressure wounds, or what people would call a bed sore. Those wounds then require to be debrided or cleaned up, but then they're left with a huge defect that many times requires perhaps wound care for certain, but many times additional surgery, and in our case, most of the time by our plastic surgeon, to reconstruct and close that area that has occurred because of another medical problem. So there are very different reasons why wounds form, and a whole varied group of people.
Well, I'm sure you've had so many patients offer their gratitude to you for being able to pick up their role in life, whether they're a student, as you said, or going back to work, or pursuing their hobby or sports or something. So it must be very gratifying to you to hear about these patients.
We always, when patients' wounds heal, many times they come out and the nurses will see that they're healed, and they'll usually get a big cheer and tell them they graduated. So because many times these patients will come to us for weeks or many times months
to get wounds. It takes that long sometimes?
It can take a very long period of time for some of these wounds to close.
Any special stories that you have that you can tell us about?
Special stories? Well, one in particular is one that's going to be featured in a video actually put out by Atlantic Health System that's going to be looking at one of our patients from the Union facility who is actually a fireman who has developed diabetes and developed diabetic foot problems, and then subsequently a foot ulcers, which were essentially potentially limb threatening anyway, where he was going to potentially, result in amputation and possibly loss of limb. He ended up not only having wound care, but he ended up in one of our hyperbaric chambers for an extended period of time. The wound subsequently went on to heal. He retained his foot and his leg, and was able actually to return back to the fire station where he'd been working as a fireman.
That's a fantastic story. That's a wonderful story about a person who probably was giving up hope, and even the awful thought of losing his foot is back working. A wonderful member of his firehouse and helping other people out. That's great. That's wonderful. So, to repeat what you said, though, there are many causes for wounds that need treatment that don't heal. I heard you talk about surgery. It seems to me that it's obvious when you have surgery, your skin is cut open. It's stitched together. You put an antibiotic on it or something like that, but that doesn't always work. It may not heal over. It might become an open sore. Is that correct?
Surgical wounds are usually prepared, and in the operating room, they're obviously clean, meaning the area is as sterile as it possibly can be. Once you breach the skin, which is one of parts of our immune system, you open that up to the bacteria that are in our environment, and our environment also includes our skin. So many times these wounds, for a variety of reasons, not always infection, sometimes simply mechanical, but the point being is that the wounds subsequently open. The sutures don't hold, the staples don't hold, or the wound becomes infected and the surgeon himself has to remove those staples or sutures prematurely. The wound then gaps open and the person is left with this open wound now that will not heal. In days gone by, before the advent of wound centers, surgeons had to deal with all these issues completely on their own, which many of them in this time still deal with wounds, but many of them, as they become a prolonged, complicated course, many of the surgeons will turn to a wound center in their facility to help assist them with closure, where more intense attention can be given to that wound. And some of the things that we use, quite frankly, are just not available in many physicians' offices.
Right, I understand that. Okay, so if a surgical wound isn't closing or healing properly and all previous care doesn't work, then you're available to take it to the next level. You mentioned the word ostomy. A lot of people don't know what that means. How would somebody who's had an ostomy have to refer themselves to the wound care center?
Well, first of all, ostomies can take a varied form, but probably the two common ones that we deal with are ostomies related to the bowel, okay. Colostomies, ileostomies.
Oh, okay.
Okay, and urostomies, which is related to the urinary tract.
Okay.
Meaning temporary or permanent diversion of the fecal stream or the urinary stream due to another reason. Can be due to cancer, can be due to other types of pathology such as autoimmune disease like Crohn's disease or ulcerative colitis.
Okay.
Things that occur that cause the need for diverting either the urine or the fecal stream to the outside, and that occurs usually through the abdominal wall. And then you have now these openings which were not there, and you need to make sure that you contain either the urine or the stool. By doing that, you have to use different types of appliances to contain that. All of us are not created the same, so our anatomy obviously being different, which means it takes the expertise of a trained ostomy nurse to be able to address the diverse anatomy that exists, the way that the actual ostomies have been formed. Our nurses now many times get involved with the surgeons ahead of surgery when they can be planned, so they can try to map out where the best place to place these ostomies are, so that the problems that can occur are minimized.
Okay. Well, that's wonderful. So in many cases, though, it's a sore around the opening where the appliance has been put, and your team goes in and remediates some of the soreness and treats it so that it's not affecting the quality of life of the patient, right?
Well, to get the wound to heal, you still have to maintain the same reasons or the same procedure that you would go through to try to heal that wound, but you still need to maintain the continuity of the appliance on the ostomy. So there are certain things that we do to try to make sure that our dressings don't impede the ostomy from containing everything.
Okay, good. You know, you mentioned bed sores, and I know that people who are, especially the elderly and frail people, lying down in bed or maybe even in acute care centers, do develop these type of sores. To get the type of treatment that you offer, do they have to be brought to your center?
If they're at another facility?
Yes.
Yes, the answer is yeah. And many of these patients will be in the hospital with their acute illness. They get transferred now to a subacute rehab facility, and then to receive ongoing wound care, they'll be transported to the wound care center to have that wound care delivered, usually on a weekly basis or at least every other week.
And you find that it really helps them?
Absolutely. I mean, because then we give direction back to the nursing staff back at the facility what to do during the interim between visits, how to care for that wound properly.
And so therefore, they're much more comfortable and they don't have open wounds and bleeding and all that sort of stuff.
Well, the patients and the family are much more comfortable because they know somebody is really paying attention to this. The staff at the facilities most of the time also are pretty helpful because they have the ability to have other eyes on the wound and a little bit sometimes of guidance. Many of these facilities do have people in them that are also trained, but many of them don't.
Okay.
and they end up with us again.
There's one more example of why your wound care center can be helpful. And I've heard of somebody who's had breast cancer, who had radiation, and then there was tremendous sores afterwards. Do you treat that as well?
Well, those are, I would say, many times some of the gratifying wounds, because you're obviously dealing with a patient, especially during an active malignancy. They're dealing with all the stress and problems that go along with either receiving radiation, chemotherapy, or both. And now they have a wound in the area of where their cancer is. It's a direct reminder every moment of every day of what's going on, and it's a negative. We help to, help the wounds to heal, but we always inform them that the healing is directly related to the treatment of the malignancy. We try to help them with the odor that can be occurring because of that, bleeding that can occur because of that, and infection that can occur because of that. So we help to give them that extra support until that wound goes on to heal. A second group of patients, though, would be patients, let's say, that have been successfully treated for their malignancy. In part of their treatment included radiation therapy. But later on in life, they develop other problems as a complication of the radiation that they received, or what's termed delayed radiation injury. Delayed radiation injury can take a variety of forms, from issues with seizures with brain radiation to hemorrhagic radiation-induced cystitis for patients that maybe had prostate or rectal cancer and had to have radiation therapy, and or radiation-induced enteritis that goes along with it, and then mainly in women with breast cancer where they've received perhaps radiation, and there's now a decision to reconstruct the problem with the tissue that either doesn't allow it to heal properly. They end up then, in many of these patients, will end up being referred for hyperbaric treatment. Hyperbaric treatment is 100% oxygen delivered under increased atmospheric pressure, making it, somewhat basic at this point, because the science behind it is not only somewhat complicated, but very interesting. By delivering 100% oxygen under increased atmospheric pressure, you make the available oxygen that the person inhales so large that you have free oxygen circulating in the blood. That oxygen goes preferentially to areas where there's low oxygen levels. Where is that? Areas that are poorly perfused, such as those that have been irradiated, because the damage from the radiation causes increased fibrosis and increased damage to the microcirculation of that tissue. So when that tissue is disrupted, it doesn't heal well. By giving that extra oxygen back, it helps that healing process, because oxygen is a rate-related component of wound healing. By giving that oxygen back, over time with serial treatments, you actually can cause what's termed neovascularization, where new blood vessels actually grow back into this tissue to make the tissue healthier and allow it preferentially to go back to healing again.
Okay, that was a lot of great information. I'm wondering how many people in our audience caught all of that. But the hyperbaric chamber provides 100% of oxygen, and it sends it all throughout the body, but particularly to where the wound is, because that's where there's the least amount of oxygen. And by putting oxygen at the wound center, at the wound location, then it helps the healing process start and all the chemistry of the body to work. Is that, did I say it right?
That's it, in a nutshell.
Okay, so I wanted to know what the hyperbaric chamber did, but it seems like it's a simple concept, but so intensely strong and effective. And it doesn't hurt to have it.
It is one of those advanced wound care modalities that you spoke about earlier. It's considered that, meaning it does not replace standard of care and normal conventional wound care. It is something that is added to many patients' treatments as it is deemed appropriate by the treating wound physician or by one of their surgeons or other physicians that are caring. In the case of radiation, many of these patients don't necessarily have a wound per se, but they get referred either by their treating urologist, treating gastroenterologist, or treating surgeon, or their oncologist back to be seen to try to enhance and improve the ability for this patient's area to heal.
What other treatments do you use on a frequent basis to help people out?
Well, again, I'm assuming you're talking about advanced wound care modalities.
Yes. Mm-hmm.
Okay. The other things that are available are any of our cellular tissue products, or what used to be called skin substitutes, which encompasses a variety of different types of tissue. You have as simple something called an extracellular matrix. So in how you would describe that in layman's terms would simply be the scaffolding in our skin that our cells adhere to. It's everything between the cells. So by replacing that many times, it allows the cells to migrate more effectively and to adhere. So it enhances healing. Those can be human-derived, they can be bovine-derived.
Oh,
okay?
interesting.
All right. We also have placental-based treatments. Those placental-based treatments come in different forms, from basically dehydrated placenta to actually living cells, where you have living stem cells and fibroblasts that are applied to the wound itself. Fetal foreskin in the form of a sheet that almost looks like skin, where you have fetal fibroblasts that again help. And they found that most of the time it's not the cells that do the work, but the cells bring in the growth factors, which are really, really important in bringing in our skin to grow and to, again, rejuvenate and close the wound.
Wow, that's absolutely amazing. So to repeat what you said, skin substitutes or skin
Cellular tissue products.
cellular tissue products are applied to where the wound is. They help the tissue around here to start growing, so eventually it will grow together and become one smooth surface again?
Correct.
That's just totally amazing. So your treatments are very advanced, very technologically intense, but fantastic. And I'm sure there's a lot more coming down the road too that will help people. So what is your ultimate goal here with your patients?
Well, the ultimate goal is always healing the wound.
Right.
And as we alluded to many times with certain types of patients, such as cancer patients, that always isn't always available, but we always strive for that. Mm-hmm. So the ultimate goal is always to heal the wounds.
Okay.
Okay. Our wound care center, is very proud of the fact that our wounds well into the high 90s we heal over time. We'll heal well over 95 to 96% of the wounds that come into our wound center.
Okay, well that's a wonderful result, and I want to thank you, Dr. Roland, for being here, explaining to us in such detail about what the wound care centers. And I want to thank you for joining us today on 30 Medical Minutes and finding out that chronic wounds can be treated and maybe even healed so much that everybody is going back to work and living their life with quality. Thank you again for joining us on 30 Medical Minutes.